Okay. Remember that we were talking about some of the impact slides. You didn't find these figures, which are many of them are copyrighted onto the PowerPoint, so they're just for my presentation and use this in the class. And again, the bacteria that I'm going to talk about today has a lot of historical perspective. Let me see. I always struggle with that. Okay, that's better for me. So many years ago, there was a article in the news. Just imagine the one quotation you just saw. If it was to come in the major news, the most dangerous woman in the world at that time. So probably when they were talking about that particular person, can we have the door closed, please? So they were talking about this old woman. So you can imagine there have been time in history of medicine, then if they were to pose somebody as the most dangerous woman, it happens to be this person over here. And the articles at the time, you can see, we're talking about 1909. So 1909, maybe you can ask your grandies to know about that. But the whole problem was that they were trying to locate a person and looking for this young woman at that time, Mary Mellon. And they thought that there was a court order by New York Supreme Court that she posed a danger to society, and she was to be imprisoned. And interestingly, she ran away a couple of times and was taken back by a court order. The problem with her was that she was trying to work as a cook. And at that time, also keep in mind that we are still struggling to find out what are the causes of diseases, and antibiotics are not there. Alexander Fleming's agar plates were okay. And there was back and forth, not only a public health issue, some of the diseases are public health issue as well. So in this particular case, she was known as Mary Mellon, and also known in history of medicine as Typhoid Mary. So what was happening was she was carrying typhoid bug in her nose or gallbladder. And she used to work as a cook, and she was the basis of epidemics that were happening, killing people at that time. That's why they were trying to locate her. And imagine that there was no therapy at that time, so people were dying. So they had typhoid, and typhoids are intestinal diseases where infection occurs in your intestine and poke a hole there and perforation of intestine. So that was a serious issue. They had no clue what they were looking for, but they knew that there was something wrong with this particular person, and she was spreading the disease. So all these rules and regulations where if a person, for example, is unwilling to seek treatment and is responsible for a public threat, so there were litigations in terms of what to do at that time. But anyway, she was a cook, and there was a big fight between her and her lawyer about the court orders, because she was passing that to the foods that she was preparing. But anyway, the point that I wanted to bring it up as classical example for typhoid is that people can carry typhoid and give it to others to such an extent that it poses a security threat as far as public health is concerned. And that's why you want to make sure that, especially those people who want to work over there, especially cooks, they're not carrying it, okay? But anyway, so the big class of family I'm going to discuss today, as the name suggests, is Enterobacteriaceae. And when we talk of entero, we possibly are talking about gram-negative rods. So these are gram-negative rods, and I'll just pick up 3 because these are the common ones that we normally see: salmonella, shigella, and E. coli, Escherichia coli. So these are classical gram-negative rods that we see to cause this kind of problem. And if we look at the whole family, they are heterogeneous. There are many bacteria to such an extent that even salmonella alone had 2,400 different types. You can imagine so much of a problem that we have. And luckily, few of them pose problem for us. And we just need to serotype the rest of them. Want to make sure that they are not causing the problem as they were causing 1909. So it's like more than 100 years. So things have kind of improved by now. And we classified these on the basis of the biochemical properties they have. For example, the most important chemical properties, their fermentation of sugars. One of the most important sugars that we take is lactose, the milk sugar. So they can be divided into lactose fermenters or lactose non-fermenters. This is a major classification that we have. We look at their antigenic structure, we look at their DNA hybridization, and we looked at the 16S RNA sequences. Does it ring a bell when I say 16S RNA sequences? Yeah. What is it about? Say it again?
The human microbe.
Very good. So when we sequence the human microbe, we sequence this particular RNA sequence. That was something I told you at that time. So it remains as one of the important sequencing things that we have here. So luckily, we have few species that are responsible for most human infections. So when we use these type of terms, most and few, so we are kind of not giving you the exact statistics. So it may vary, seriosity, person to person, so on and so forth. But the classical organisms in the bigger family are present everywhere. They are present in soil, water, vegetation. They are part of normal intestinal flora of most animals, including humans. And this is now important statistics that we do see. Like if you go to the clinic and 1 out of 3 person having blood infection of bacteria, so these are the culprits. It's going to be Enterobacteria. And again, 2 out of 3, which is urinary tract infection. So most common cause of urinary tract infection is Enterobacteriaceae. Okay, and of course, they will cause intestinal infection anyway because they are enteric. They are their intestines. Now, when we talk of specific organisms, some of them are associated with human disease. So these are, as we discussed earlier, always pathogenic, right? So they are Salmonella, serotype typhi, Shigella, and Yersinia pestis. What does Yersinia pestis cause? Anthrax. Who said anthrax? Plague. 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 So then some of our opportunistic infections, they are Escherichia coli, Klebsiella pneumoniae, Proteus. We talked about that earlier. They are also a member of the normal commensal. And these are some of these which acquire virulence factor via whatever we discussed before. The most important in that case is E. coli. So this is like a broader family characteristics of these bacteria. Now, as far as where they originate from, they do have an animal reservoir, especially Salmonella, Yersinia pestis. We talk about that. And these are human carrier. I just gave you an example of typhoid Mary. And then again, some of them are endogenous spread. This means that they are already there in your intestine. For example, when they operate on intestine, they're already there. So if they don't take proper precautions, it's going to come out and cause infection of peritoneum and spread from there. But the most important thing is that especially E. coli, who has E. coli as individual topic? Yeah, so E. coli is one of the most important bacteria that we can think of these days in terms of infecting virtually all body sites. So So you can imagine this is one of those bacteria which has capability to cause problem to each and every organ that we have. Now, if you look at the journal classification in terms of what problem they have, I talked about bacteremia, we talked about endocarditis, we talked about intestinal, and we talked about urinary tract infection. So urinary tract infection, they are enteric, and they can also cause bacteremia. Then, of course, some little percentages of them causing problems in the central nervous system as well because of the neurotoxins that they produce. If you were to look at the incidence as a whole, again, it keeps on varying, but you can see the most important, as I just told you, is Escherichia coli. Half the cases from this family are coming from E. coli. Then we have 22% Klebsiella, 20% Enterobacter, and then Proteus, Serratia, Citrobacter are small percentages, but they exist. So this is how you have to deal with this bacteria. And this is how mostly the questioner asks, if you're wondering what type of questions are going to be asked in epidemiology. So these are the epidemiological questions that will be asked in terms of percentages. Half of the infections that we normally see among the Enterobacteriaceae is coming from E. coli. This is a typical Gram staining, and you can see we call bipolar staining because it kind of stains the edges. You can see stain in the edge and little bit is clear in the middle. So Gram stain of Salmonella typhi is from a positive blood culture. And that's a typical staining we call bipolar staining because both poles are stained. The most important thing for Gram negative, as we've been talking over and over again in immunology, their virulence factor is endotoxin. So endotoxin is the virulence factor here. And then they have all these things we've been talking over and over again. They have capsule, they have antigenic phase variation, they have type 3 secretory system, which I told you earlier as well. It's like the bacteria has an injection. It carries an injection with a syringe and with a nozzle, and it penetrates into the cell and then kind of slowly inject the poison or toxin in this case. A very precise, very meticulous, as if they really have a proper syringe where they will inject that. Just called type 3 secretory system that we have in terms of bacteria causing infection. They resist to serum killing, and antimicrobial resistance is pretty much the theme for most of this bacteria. Now, if you look at the structure, these are journal structure for the whole family. Enterobacteriaceae, you can see from here, typical lipopolysaccharide with the O, with polysaccharide core, and lipid A, which is anti-endotoxins. I usually ask this question, which of the 3 parts of a lipopolysaccharide is actually an endotoxin? So endotoxin is basically lipid A part, that's called endotoxin, and the whole molecule is called LPS. But sometimes we use it synonymously as well. But if you want to go for biochemical, that's what it is. And then again, you can see typical structure where it has an outer membrane, a periplasmic space, and I don't want to go in detail. We spent so much time already on how does a typical cell wall of Gram bacteria look like. The important thing that some of them may have flagella, and that flagella is for movement. And we can also pick up an antigen from flagella, which is H antigen. The capsule antigens are K and VI, and these are the antigens which are required for us in terms of an antibody response. Okay, they are Gram negative, we talked about that. They are anaerobes because they are in intestine. There's no, air there, but they generate the air. They are oxidase negative. And as I told you, there are about 2,500 serotype. And then the most common diseases that as a whole family they cause enteritis. That's what we call Enterobacteriaceae, inflammation of intestine. And then enteric fever, typhoid fever, bacteremia, asymptomatic colonization, as in case of typhoid Mary, that you yourself don't see a disease. And that was a problem with her. So they would want to put her in the prison, and she would say, I don't have a disease. So they used to go to the court, and the attorneys would fight a case. She's not sick. How can you want to treat her? So that was a big challenge in the early 1900s. That what do you want to treat, and no antibiotics and things of that nature. Okay, now Most of the slides in epidemiology will talk about incidences, the percentages, how do you get the disease, how can you prevent the disease, what are the public health measures, and so on and so forth. So it's more of a topic for infectious diseases. It's going to be a mandatory for you, especially when you go in senior years. So most of the problems that we have are coming from contaminated food. So these are foodborne diseases. And if our foods are contaminated by Enterobacteriaceae, poultry, eggs, dairy product, that's where the common problem is. And the spread, especially in the children, in fecal oral. And as far as Salmonella typhi, there are two types of Salmonella. We say typhi and paratyphi, as we talked about influenza and parainfluenza. Okay, so they are strict human pathogens. They don't have any other reservoir. They are spread from person to person, right? And they may have a long-term colonization that you may carry it and don't show the disease. The individuals who are at high risk are those eat improperly cooked poultry or eggs, patient with reduced gastric acid, because normally your gastric acid is going to kill. They are not acid tolerant. But if you are chronic use of antacids, you've already messed up your so that's a typical question there. And then that what are the causes and what are the bacteria that are acid tolerant and may cause disease. They're not acid tolerant, correct? Correct? All right. Typical diagnosis is that we take a stool sample and grow them to find out if they are there, okay? And as far as treatment is concerned, now we do have a treatment, antibiotic treatment. We do the culture sensitivity. We want to test for all those drugs that we have. And as far as control of infections are, we pretty much have to make sure that we have proper meals cooked and decontaminated and so on and so forth. But these are like the general things that we have. If you were to travel to those areas like Asia and other places, you may want to get vaccinated against Salmonella typhi because still there's a very high incidence over there. The water is unfit for human consumption. So that it will be a travel clinic things that they will want you to get vaccinated. Okay. Shigella, basically the difference between Salmonella and Shigella is that Salmonella was more of small intestine thing. That's called typhoid. Whereas Shigella actually replicates in colon. So that's like the major difference between the two groups. They are also, again, gram negative. They are oxidase negative. They also have a lipopolysaccharide. We discussed that earlier. Salmonella had two types, typhi and paratyphi. They have more than two. So they have Salmonella sonnei, which basically is very common in US and very common in developed country. And then again, flexneri is in underdeveloped or developing country. And then we have mostly S. boydii, which is not commonly isolated. So these are the three important, actually four important: sonnei, flexneri, dysentery, and boydii. So these are four common. The most common in US is S. sonnei. As you move to different parts of the world, you may look at different incidences. Who's doing that topic as an individual project? Shigella. Okay, make sure you look at the WHO statistics for all those different types, giving you incidence for that. Now, the questions that you see, a larger family Enterobacteriaceae, that's what for every lecture, I'm going to give it to you, as I said the other day. So you make 3 columns for this one, 4 columns, so you can find out what are the differences between these two. When we talked about Salmonella, we talked about that it resides in small intestine as compared to Shigella, which is in colon. In Salmonella, we had endotoxin, which is a part of the structure of the bacteria, whereas in this case, we have exotoxin. Okay, it's also called shigatoxin. And this basically is produced by the type dysentery, which basically will disrupt protein synthesis and produce endothelial damage. The most common disease that we see is gastroenteritis, and there are tons of causes of gastroenteritis, but if it is caused by shigella, we call shigellosis. If it's called by salmonella, we call salmonellosis. If it's called brucella, we say brucellosis. It's like a typical term to make your life easy and life of other people easy as well, because you know what's the culprit here. It causes watery diarrhea and abdominal cramp, and then if you have, what is tenesmus? It's like a very colicky pain that it comes to your belly. It comes and goes, and many a time it's relieved by defecation. It's very, very common for gastroenteritis. And many a time, if this bacteria invades deeper part of your intestine, it may lead to bloody diarrhea. So you can see the bloody diarrhea or bloody stools will come. And the difference between diarrhea, where you pass watery stools, when it comes to bloody diarrhea, we call it dysentery or dysentery. So that's the difference between diarrhea and dysentery. The dysentery means you pass blood. So it's like bloody stool as compared to watery stool. So if many times patient would not know the difference, so they will mention I have a dysentery, but probably they mean diarrhea. So you have to ask them that you pass blood in your stools, it's a bloody diarrhea, then you can make out the difference. Again, you can have an asymptomatic carriage, and the whole picture pretty much is foodborne disease, gastroenteritis, one of the causes. Epidemiology, humans are the only reservoir, and person-to-person spread is fecal-oral route. So if you don't wash your hands after going to restroom, or people working in the restaurants are not careful, they're not taking care of their sanitation, that's where it comes. People at higher risk, of course, are young children because they cannot clean themselves at all time. Nurseries, and then again, the special group, we'll talk that in detail for STD, is male homosexuals. When relatively few organisms produce disease, we call that particular disease as highly infectious. You just need a couple of bacteria to cause disease as compared to those diseases which require a lot of bacteria. So that's called the dose of bacteria to cause disease. In this case, it's highly infectious. Disease occurs, worldwide, we know, and then again, as we said, person-to-person spread is common because it needs low inoculum. Inoculum is the inoculum that you use to culture that little string that you have, metallic string with the tiny little loop. That's called inoculum. So you just need, low inoculum means you just need a slight touch of that to cause disease. In this case, so if other person is infectious, so all his fomites, beds, linen, toilets, seats, and so on and so forth, all could be contaminated. All you need is a little touch, and then you also get infected. Okay. Again, like salmonella, the diagnosis is based upon stool specimen, like salmonella as well. So you need a stool specimen for that. Okay. For antibiotic therapy, depends upon the disease. If it's watery diarrhea, we treat it differently. Sometimes we just replace the last fluid or give symptomatic treatment. If it's a bloody diarrhea, then of course we have to intervene because the person maybe have fecal shedding. So fecal shedding means that these bacteria line the wall of intestine and the person is going to shed. Like those people shed by talking, if you have oral shedding, by sneezing, all these different ways of shedding bacteria and passing on to others. The common use is empiric therapy that we have fluoroquinolone or trimethoprim sulfamethoxazole. And then again, good sanitation is required especially for hand washing and proper disposal of soiled linens. So again, foodborne disease, common in restaurants, hospitals, nurseries, and so on and so forth. And Escherichia coli, who's doing Escherichia coli? I may have said it again, right? So you told me, right? Escherichia coli, you have to really do a good job because that's basically one of the most important bacteria that you will see. And again, also for those of you who are going to send their, because there are two presentations. One is your audio recorded PowerPoint presentation, and one is your vocabulary of the names of bacteria you have to go through, right? So one of those names which are difficult, Escherichia coli. So you have to practice it, Escherichia coli, right? So make sure, because you're going to put yourself in a very bad situation in front of a physician or a hospital when you say, what bacteria is causing this disease? And I don't want to say what people sort of have weird. So make sure you practice that. One of the most difficult one, I believe. And then again, and this is the one very commonly in press, in news. There's hardly a year when there is no reported outbreaks. There are always outbreaks for that. And then again, they have, for example, in this particular year, last year probably, they had 173 cases in 25 states, 50% people were hospitalized and one death. So this is very common, spinach, poultry. So that's where we do serotype. So Escherichia coli, we do serotype. And then again, there are a couple of YouTubes that you can watch on your own. And as far as the comparison is concerned, because, I'm pretty sure you're more interested in what's going to be asked in the exam, is that if I teach you like 3 or 4 bacteria, make sure you make charts, right? So you have all those similarities, dissimilarities. Because, I know somebody was complaining about the immunology test that, questions are coming from different where. But in this case, questions are going to be jumbled together. So if you're 10 lecture, don't expect 5 questions from Staph aureus because the distractors are going to be all over the places. That's what the most important thing is in bacteriology. So you start making your own concept maps, they call, and start making your own tables, right? In this particular group, you want to make sure that you put similarities and dissimilarities. And especially for those books that are not required, recommended book, they do carry those charts. And I asked students to make it for me last year, but there's too much of me to post it. So I would rather have you do on your own. Anyway, Escherichia coli, gram-negative, anaerobic rods, they are fermenters. Salmonella and shigella were lactose fermenters. So lactose fermenters is important. This also has a lipopolysaccharide, and the lipid A in this case is a endotoxin that I've been telling you over and over again. And then there are 5 different pathogenic groups, and I want you to know them all. And I'm going to help you to learn it, but because they are very common, we see it every day, and there is a good way to learn it. So I'm going to go through that. So these are 1, 2, 3, 4, 5. Very common, the most horrible or dangerous of all these is the one which is EHEC, which causes hemorrhagic colitis, as the name suggests, and it causes one of the notorious disease we call hemolytic uremic syndrome, HUS, in the United States. So we have to be very careful for that. And then again, it does cause some extra intestinal diseases like bacteremia, neonatal meningitis, UTI, and intra-abdominal infection. But by far, this is where we're going to spend some time today. Okay. Now, very good table from your book. And it's easy. You just want to have a little bit of a concept. The most important thing that you have to keep in mind that this is a chart for gastroenteritis. So gastroenteritis, remember, is a very common feature presented in ER. People are so fond of exogenous, exotic, or food. They want to try everything, so they sometimes have to pay the price for it. Okay? Now, you can see from here, 1, 2, 3. The first 3 bacteria, I'm just going to go over here. Site of action, first 3 bacteria, the site of action is small intestine. Okay, the last two are site of action is large intestine. Okay, now if you look at the name, all of them will have EC in the end because they are Escherichia coli. It all will end with EC. Now, if you go for the first one, for example, you say ET, EP, EA. What does it say over here? EAA. So the point in this case is that this is a mechanism of pathogenesis. For example, in the first one, if it is because if you look at the intestine, for example, from inside out, so you see epithelial layer, submucosa, muscular layer. In submucosa, you have vessels, and then there is a serosa. So in order for bacteria to be invasive, so this classification is based upon invasiveness of bacteria. How far can it go? So if bacteria, for example, just touches superficially and just irritates, so you can see from here, it will just cause traveler's diarrhea. So it will just be a diarrhea, which is watery diarrhea. At the best, you will have vomiting, cramps, and a low-grade fever. But this is a enterotoxigenic. So ET is like just kind of touch over there and release some of the toxins. But it's not that invasive. Now, in the second part, if it is enteropathogenic, right, it will again cause watery diarrhea and vomiting, but no blood. So still in these two, there is no blood, but it's a little bit deeper as compared to the first one in terms of severity of the symptoms. Okay. Now, as we go for the third one, is called enteroaggregative. This is where is the other name for enteroaggregative. You must have heard people say traveler's diarrhea. And there are a lot of medicine over the counter, traveler's diarrhea. So you wonder, what is traveler's diarrhea? So of all these 5 types, this is the most suitable fit for so-called traveler's diarrhea. Okay, and this is a E. coli, Escherichia coli. It is enteroaggregative. It affects small intestine, and it has a persistent watery diarrhea with vomiting, dehydration, and low-grade fever. Okay. Now, if you pay attention, some of the questions which are here in terms of differential diagnosis, how would you differentiate these 5 on the basis of clinical history, for example? Right? So there are many ways for diagnosis. We can diagnose patient on the basis of their presentations. How do they present? We can diagnose patient in terms of clinical picture. We can diagnose patient in terms of laboratory testing, and so on and so forth. So there are different tiers of our diagnosis. So in this case, what you are looking at is that all of them cause diarrhea, that's for sure. All of them are important cause of infant diarrhea, right? But remember, having said that, things are not so clear. Sometimes it gets ambiguous because this is our way of classification. Bacteria may not follow our classification. There may be an overlap in the symptoms, right? So it will be very difficult for you to pretty much differentiate this from this, for example, right? But you know for sure that all of these 3 are affecting small intestine, okay? Small intestine. And you also know that all of them, especially the first and third one, will not cause high-grade fever. They call low-grade fever. And you also know that none of them will have dysentery in blood in the stool. So that's how we differentiate. The physician in ER is trained to listen to the patient carefully and figure out what is it that he puts. Like we have like distractors, question 5 distractors. So he's going to come up with a symptom and then say, hey, I think it could be 5. He comes up with 5 different bacteria, and it's going to exclude each one of them by exclusion. That's what we call differential diagnosis. He can do on the symptoms, he can do on the basis of clinical picture, and then even then if it's confused, he's going to go for the test. So test will be the last resort for him to, because that's for sure. So that's like diagnosis then. Now, the other important thing that you will see over here is that they all have plasmid-mediated problems. So that's the problem. If you were to look at the history, the histology of the intestine, if you were to cut it up and see like biopsy, you will see they all are plasmid-mediated. So that's what the problem is that you're seeing, plasmid-mediated with all the things that we have. Now, if you go to the colon, large colon, which now you will see again enterohemorrhagic. This means again the blood. Hemorrhage means the blood anyway. So it will start with watery diarrhea, and then again it's gonna progress to blood being shed, right? And the most important thing in this case is that, as I said earlier, it may lead to one of a very severe symptom, which is hemolytic uremic syndrome. If I was to ask you, which of these 5 is going to cause hemolytic uremic syndrome, so you can see this one only will cause that. Okay. Again, you will see as far as fever is concerned, when it affects small intestine, you have low-grade fever. When it affects large intestine, you may or may not have any fever. In fact, you can have no fever. You can see it's no fever, so there's no warning. And then the person may have very severe consequences for hemolytic uremic syndrome. Okay? And again, you will see over here that it is based upon some of the shigella toxins. So these are like shigella toxins that will disrupt the protein synthesis and will destroy the intestinal microvilli. So what is the consequence if I tell you that this particular bacteria in terms of pathogenesis, remember pathogenesis, one of the 3 objectives of each and every bacteria. How does this bacteria cause disease? So if I was to tell you that this particular bacteria's pathogenesis is going to cause necrotic lesions of intestinal microvilli, what will happen? What is the consequence of that? Louder.
Blood?
Yeah, we already talked about blood. Blood is there. What else? Toxin causes that. Say it again. Tissue damage is necrosis. That's what I'm telling you. But what is the implication of that? Very good. Absorption. Where do your food get absorbed? Microvilli. Answer is there. Decreased absorption. So if you have necrosis of microvilli, you cannot absorb food because you need microvilli for absorption of food. That's where the enzymes are. Does that make sense? So you have a major problem over here, okay? And then again, these are typical pathogens. So those of you who are doing individual projects or those of you who are preparing for the exam, make sure you understand the pathogenesis, right? Because that's what is important for us. What is the story? I've seen quite a few writing, in pathogenesis slide, as I saw and marked you just write shigella toxin, doesn't say anything. But when okay, fair enough, you can say that, but when you do audiovisual, I want to hear what does shigella toxin do. If you say AB toxin, I want to hear what does AB toxin do. If you say type 3 secretory system, I want to hear. That's what pathogenesis is, because you want to stop that, okay? So these are the 5 important Escherichia coli that we come across, and we see, as I said, hundreds of cases every year. And again, for epidemiology, other than that, we already talked about some of the aspects. There's nothing special over here. And diagnosis could be, there are 3 important aspects for diagnosis, especially for Escherichia coli, because this was the one enterohemorrhagic that I said the most notorious. it is detected in reference or research laboratory. So if a person comes with hemolytic uremic syndrome, and that's going to be very serious for the company, for example, if they can report it on spinach, on eggs, so there's a big litigation for that company, and this is going to involve millions of dollars. So they want to make sure that it is done in reference lab. So if you come and grow Escherichia coli, doesn't tell you anything. It has to be that serotype strain, particularly, and the FDA will go and pick up that strain and go and examine their lots of food and kind of find out, match between the two in terms of strain type. Okay. Now, as I said earlier, many times people don't notice because it's pretty much mild. So all you need, nothing you can do. But if it's symptomatic and if the dissemination of disease, then you want to make sure that you go for antibiotic therapy. And again, especially in hospital, it's called nosocomial infection, you want to make sure that you better take care of the patients, especially one of the things that they would advocate is not to use urinary tract catheters, because that would allow the bacteria to go in. Normally, the flow of urine is unidirectional. But if you put a tube in any part of the body, that gives bacteria kind of something to hatch onto, so they'll kind of walk on to catheters and then move up, cause infections. And then again, proper cooking, especially for the beef products, is advised. And we have to make sure, and you will see that next time when you go and buy a meat, you will see they talk about EHEC. Next time, do like an assignment and see if FDA will give that approval for that. Now, the other important thing for all these bacteria in terms of having some pathogenesis features, because I think the experience I have that people do good in memorizing and cramming things in questions when it comes to pathogenesis, where they need to kind of have a concept or critical thinking, that's what they get lost. And it's difficult for them to pick up the right distractor. Now, the question was, what is the difference between E. coli and enterotoxins? So, as I said, that is a heat labile. So these two things you will see over and over again, and this is a basic concept of biochemistry, and I know you know more biochemistry than myself, so I'm not going to go in detail, but I'll just give you, and I want you to know, I'm going to ask you, is that sometimes what happens is that this particular bacteria, a toxin, it ribosylates a regulatory protein, and that will cause constitutive activation of the host adenyl cyclase, which we'll call elevation of CAMP, right? As compared to some other. So if I was to ask you, what's the difference between a toxin which is heat stable versus a heat labile? Okay, and this will come over and over again as well. So in this case, one heat labile causes elevation of CAMP as compared to the heat stable, which causes elevation of GMP. Okay, I'm not going to ask you what the mechanisms are, but I'm pretty sure these are the two important concepts in biochemistry that you need to know if you want to understand some of the mechanism of the drug. I'll just give an example, for example. So what happens is that in some of the diseases, for example, if there is a elevation of CAMP, so what will happen is that you will lose electrolytes. So you lose sodium, you lose calcium, you lose potassium. Okay, and that would be the major mechanism of action of bacteria in terms of causing toxin. So you have to replenish or compensate for the lost electrolytes. Okay, and make sure that you give that in terms of compensation for that. So bacteria. It could be bacteriostatic or cidal, but they would not do anything for the toxin. So we are more interested in enterotoxins. The other important thing is that I said earlier, if something was, we call that food chain or cold chain. If a burger was made, for example, in Florida, and it has to come over in Chicago, so it takes like 60 or 30 whatever hours, for example. So they want to make sure that there was not a break of the cold chain. If the truck bringing burger failed on the way for 6-7 hours, right, and the bacteria start dividing and releasing toxin, even if you come and put them in the freezer, it's not going to help you. It may stop bacteria, because bacteria would not grow at freezing temperatures, but nothing to do with toxins. So toxins are a serious concern. So I would rather have you look at your biochemistry notes and look what are the mechanism over here, especially in of things that we were talking about so much, activation of host adenyl cyclase causing elevation of CAMP, right? And there are quite a few drugs, anti-asthmatics, anti-diarrheal, and many more, which are based upon that principle. And you will get that question everywhere because it's so important and so common. Okay? So let me stop here and